Like it hurts a little.
Good.
Oh my heavens.
Oh, that's perfect.
Oh.
Breathe.
Oh my god.
Perfect. Lean your back. Let your head drop. Good. Let your shoulders drop. Good. Good.
Oh my god.
You want to stick around for the rest of this video because we've got mouth-watering chiropractic adjustments for you today. Full body, head to toe. We post every single day. Make sure you subscribe so you don't miss anything. Let's get into it. Up next, we have Dr. Brent Binder.
Your PSI.
Yeah, that hurts.
Here. Feel that inflammation in there?
Yeah, I don't know. Like I said, I didn't see a doctor. I probably should have.
So, people usually don't come here and tell me how good they're feeling. So how can I help you today?
Fell off my boyfriend's motorcycle last week, so my back's kind of messed up. But I kind of just fell off the back.
She fell off the back?
Yeah, that's
Okay.
what happened.
Alright, so
So I don't want to say accident, maybe incident. It was an incident.
Have you ever been adjusted before?
I'm going to say no. Like, not fully, no.
Okay, so you had someone look at you and do a
Yeah.
little bit of work, but not a full spine adjustment.
Okay.
Okay, so let's see what your spine says and we'll go from there.
Okie dokie. You're going to put me to sleep.
Alright, so the tone starts up here in the top left. A little bit increased activity. Nice and even all the way down until we get to the lumbar spine on this side, which is just a little bit warmer. Okay, so let's see what's going on in the sacrum here.
Yeah, that hurts.
Okay, so it's tender here. This is S1. I'm going to put my hands on your hips to locate the lumbar spine, okay?
Mm-hmm.
Okay, L4, L5, S1. So this is the 4th, 5th lumbar vertebra. So,
Like where you're pushing?
okay, here, pain?
Not as much.
Not as much. So S1, S2, now right side. Pain there?
Mm-mm.
Pain here?
No.
Good, pain here.
Mm-mm.
So there's one other spot here. Is that tender?
Yeah.
Okay, not so much on the right though.
Yeah.
Okay. Go ahead and stand up for me. And face that way.
This way.
Yep. The bruise?
Yeah, I don't remember your bruise.
Okay, there.
It was like big black and blue, now it's finally healing, but it was...
Okay, this whole thing right
This
here.
was scraped all the way down, but pretty much healed. But yeah, this is like just green, a little bit of purple. It was literally like... Okay.
So we want to even out your pants so it doesn't throw off the angle. Okay. But there's a little bit of dropping here on the right, and the left is raising up. And so watching the feet is a little bit different. Okay, stop walking here. And it's just about perfectly even right here. Looking from the top angle, it's slightly more elevated on the left, which means this would be going EX and this would... All right, Kayla, here's what we're gonna do. A nice normal walk this way towards me, okay? Yeah, right towards me, towards the camera. All right, looking at the feet first. We've got some crossover happening there. Go back the other way. No,
Turn around.
Yeah, turn around, yep. All right. Okay, so the feet are moving or go all the way down, all the way down. Walk a little bit faster. You can see.
No.
Okay, keep coming. Just walk normal.
My short legs look like I've walked a runway.
And your toes pointed inward.
Yeah.
All right, coming up to the hips.
Started my life.
Swing looks pretty even. A little bit more shoulder swing on the right. Turn around this way. All right, that's good. How's it feel when you walk? You feel it in your tailbone?
No. Well, the only place I feel in my tailbone when I've noticed, like, I've been able to kind of, the first couple of days I really couldn't move. Then I was able to walk, and now it's just like, if I bend over to a certain point, it hurts.
Okay. Okay, so we're going to see what your spine feels like laying down, because it sometimes tells a little bit different story. All right, now a little bit more gentle coming down into the lumbar spine. Do you feel a difference between the left or the right here? Here. Good, down. Okay, now left. Down. Okay, one more, right. Down. Hold on, we have to do that one again. Just let your back fully relax. There you go. Okay, right. Down. All right, so let's take a look at the legs. Bring this up here. Okay, a right short crosses over to become a right long. Everyone has one leg shorter than the other. That's right now. Okay, lift your right hip up just a little bit. Go down. Go left hip up just a little bit. Down. Points here in the glutes. It's good. I'm gonna do a test with a tuning fork, okay? And so basically, you're gonna hear me hit the tuning fork, and then I'm gonna place it on top of your tailbone. Pain? You'll jump off the table, okay? The vibration will make you basically scream.
Like it hurts a little, but not a lot.
You would know.
Yeah.
Nothing, right?
Yeah.
Good. We'll just test the L5. All right, so same thing again. Deep breath in through your nose and out through your mouth. Good, and just kind of sink in. Let it all go. All right. You have a very flexible upper thoracic spine here. Yeah, let it go.
Oh.
And then this one forward just a little bit. Okay. Okay, so what we're gonna do is we're gonna do the same thing. We're gonna follow your breath, and as you breathe out, we're just gonna stretch. Good, gentle, gentle. Good. Lay on your back. Let's do the other side. Okay, lay on your side, face the other way. Do you crack your own back?
Sometimes, yes. That's like the only thing that cracks on my body because I feel like I'm double jointed. Like my fingers don't crack, like nothing. But in the morning, I wake up and I go like this sometimes, and sometimes. But
forward again. Through your nose and out. Good. Shoulders relaxed. Good. We're gonna bring this down a little further.
oh. When you say I can't tell if you're being serious or being sarcastic.
No, it's serious. Yeah, it's and out. Good. Sinking in. Let your shoulders relax a little bit more. Good.
Oh yeah.
Lay your back.
What do you mean?
Yeah, get off the table. Get up off the table.
Okay.
All right. Let's take it for a test drive. Go ahead and walk to that side of the room, and then walk back to this side of the room.
I feel weird. Is it weird if I say I feel high right now?
No, that's great. Yeah.
No, like I really do. Like I feel like.
Did you say high or high?
High, like.
Oh, yeah. That's actually
like
really...
a natural high. Like I feel.
That's
I don't
right.
know. Relaxed. I'm really weird.
That's awesome.
It doesn't hurt as
One
bad.
more time. Keep going. Go down,
Stretch.
bend your... Yeah. And then come back up.
That was my shoulder.
We're going to get there.
Wow. No, that wasn't bad. That felt good. That was scary.
Mm-hmm. Good. Good. Let it go.
Oh my goodness. I don't even know how to react to it. I feel like I should be in pain and I'm not.
Okay, so we're going to do the lower cervical now. And so for this one, we're going to bring it down a little bit further to like right about here. Not through your mouth. Good.
Oh my god. That was intense. I feel like that was like 22 years of like never having my neck cracked.
It's good. It's good.
I feel like I can get up and like headbang now.
Almost. Hold on. All right, let's do this. Bend both your knees so your feet are flat on the table. Okay, push your knees out against my hands. Out, push. Harder. Okay, relax. That's okay. All right, squeeze again. Squeeze. Squeeze.
I'm squeezing.
Good. Okay.
Make me feel weak.
Hold your knees together. Okay, we're gonna do an ileocecal valve. We're gonna test how you're breathing. Okay.
Not that long ago.
She's looking at you.
I was looking at. No, we just ate not too long ago. We took the dogs. Yeah, right before we came, we took the dogs for a walk and we got food right before we did.
Did you feel that? Did you feel it underneath my fingertips? So, hold on. Is this tender right here?
A little bit.
That's good. And out. Good. So you keep going. Do it.
So I have to like consciously think about it.
Yeah. Let's do 10 of them.
I don't think that was my stomach, was it? I'm hungry. Nothing else to do with any of this.
Good.
I feel loose. I feel too loose. I'm alive. That's good, right? Ready
Squeeze. Good. Relax. Okay, now let your shoulder relax here. Let that go.
Oh my gosh, my friend Brie does this to me all the time.
What's that one?
Pull my Band-Aid off.
Okay, good. We're gonna bring it back. Bring your shoulders, pull your shoulders back. Good. Okay, now relax. Good. 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 For a long
But
time.
it does.
What?
It has movement.
Yeah, for a long time we did not think that the cranial bones moved at all because the sutures are fused joints. Not only do. Okay, so I'm gonna do a Chinese pulse reading test. Okay.
Are you Chinese?
All right, look straight ahead. Okay, let's see the right side. Just come down.
I'm trying
Right.
so hard. I just wanted to be quiet. I'm not used to being in silence. So like when I am, I'm just like, I can't be quiet. I try.
What's happening?
No, I feel like definitely after my modeling trips though, with my back the way it always hurts, I feel
Sure.
like it would probably be beneficial to come in here.
All right, we can do a follow-up. Go ahead and
Yeah.
walk around a little bit. Take it for a test drive. Tell me how it feels.
Take for a test drive.
Some new kicks.
I feel so loose. I feel like part of this I should be like, this is all in my head. Like, I shouldn't be thinking like, oh, he just did all these things and I'm really thinking I feel good because he's telling me these things are working, but I feel like I actually feel good.
Good. Okay, so you're aware of the placebo effect. Of
Yeah,
this.
no, that's what I feel like this should be right now, but I feel like I actually feel good right now, which is kind of messing with
Now,
not at all.
The
It's
only
just
thing
like,
the only thing that's going to help with that breathing is if you practice
Doing
using
that?
that muscle.
Okay.
Yeah. Doing more cardio is only going to be more difficult for you because you don't breathe properly.
Okay.
You know,
so you gotta
it's
fix
just
it. Okay.
yeah, it's form. There you go. So you just did lung.
Yeah, I
shoulder
did. I
breath,
know, I
yeah?
did, but I corrected
Yeah.
it.
That's okay. Every breath you've taken for 22 years. Actually, no. When babies naturally breathe with their bellies. If you watch a baby
Yeah, I
breathe,
know.
they naturally do it.
That is true.
It just becomes a matter of time before society strikes enough fear into you that you start that secondary breathing with your
I
shoulders.
feel like it's like a panic breathing now, I think.
Awesome.
This is great. Thank
A
you.
little bit of sciatica and seem to have like kind of messed up my lower back here. I have lower back pain all the time from working on my feet as well.
Okay. You excited? Nervous?
I'm really excited.
Let's
because
do an exam on your spine. Yeah, coming up, there's a little bit of antalgic gait, avoiding the left foot coming down. It hurts when the left foot hits?
Yeah, like I said, when I put
Okay. And high left shoulder, you're leaning away from the left side. And then one more time, turn around and go back that way. And so there's a little bit of heat coming off of the lower left lumbar, but really the right side is almost. That's 3.
Yep, on the left.
That one.
Yeah.
This is edema. Let's do this. Let's just looking here, you have just the slightest little curvature. And then we've got a lower on the right posterior inferior, looking from the top, slightly rounder, externally rotated PIEX right. Okay, any increase in pain in your left leg, left hip?
A little bit tenderness, but nothing dramatic.
Okay, leg raiser. I'm gonna bend your toes this way. First, just so you
Okay.
can kind of feel what it's like. Not pushing yet, but I'm gonna follow your breath down like this. At the end of your breath, we'll push like that, okay?
Yep.
Okay, another deep breath in. And out. Good, sinking in, let the shoulders relax. Let's go, let it go. Okay, nice. Deep breath in, all the way in far as you can go. Good, and out. Okay, I'm gonna move your head over to the side. Just kind of like.
That was so good.
Good. Okay, breathing in through your nose, out through your mouth. Go let the shoulder come up. Very good. We're gonna bring the hip down. There back.
Same.
So we're gonna bring 2 inches, 3 inches down. Here's the acetabular ridge. Nice, gentle, deep breath in through your nose and out through your mouth. Good. We're gonna bring your hip down just a little bit. Turn your head so you're facing straight that way. Other way. Good. Perfect. Lean your back.
This one felt a little bit more force, but still good.
Turn your head to the right, left. Back to center. Okay, again to the right.
Yep. Tender.
See this right here?
Mm-hmm.
And this is related to your sacrum all the way down low where we're working on that issue. I'm going to do some motion here. Just let your head sink in, let it go. Good, there it is, right there. Okay, so we're going to adjust your neck on the... Good, sinking in.
I feel fine, but based on what you did, I feel like I shouldn't be able to walk.
Got stuck. Let me ask you, how does that feel?
Oh, it
compared to
hurts. Hurts more the further up you go, though.
Okay, nice and gentle breathing, just like that. Same thing again. In. Good. Out. And out. Good. We're going to lift your head up. Good. And pull this out.
Like it went to about here, but like I even felt like a pop in my shoulders almost.
Okay, gentle. Let it go. Good. Go, let this go.
I know.
Is that usual?
Yeah, I mean, it's that kitchen habit. Like, you go in, you slam coffee till like noon, you know, sample a couple things, and then around like 3-4 is when I get my lunch, actually.
Okay, so you're almost there.
That's where it's tender.
Now hold this to your nose and take 10 deep breaths.
What is this?
It's an essential oil blend.
Like a solid 11 in there for good luck.
Okay, keep breathing.
Like physically feel it myself too. Like it feels more full on this side of my body than it does on the right. Like I have a permanent chill right now.
How's the tenderness here?
It's really not bad at all.
Tender?
Yeah, a little bit.
Let's do a trigger point here. Breathe in. Out. Breathe, keep breathing. Breathe. Breathe, breathe in. One more.
As painful as it was when you did the pressure points, I definitely did feel like relief throughout my whole body though. Like the area hurt, but the rest of me wasn't tense.
Pain?
There. Oh my God.
Okay, gentle. Deep breath in through your nose. And out through your mouth. Good, now let everything sink in. Let your shoulders sink. Good, let your hips sink. Let it go.
That was crazy.
Go with the shoulders down. How's that? Is it still tender?
Not as bad. That feels good.
Okay. Okay, this one's a little bit different. This time we're going to push at the top of your breath, okay? It's releasing. Good. Super deep. Good. Deep breath in. And out. Come all the way down. Good. turn your head and face straight that way. And then what we're gonna do is I'm gonna bring your hips down to like here, and then give a little push like that, okay? A little bit of a... Okay, take a nice soft breath in, out. Good, let your shoulders relax and just kind of let this come down. Good, gentle. There's more, hold on. Perfect. We're gonna bring this up to here like this. Okay, good, nice and gentle here. Oh my God. Okay, so for the next one, what I'm gonna do is bring your head down to right about there. Okay. Gentle, good. Just kind of let everything relax. Good. Breathe out. Oh my God. Characteristics of alpha dominance.
That's good.
I bet. Thanks. Plates are here.
Plates are along here.
Okay. Just kind of want to let that relax. Let both of them relax. Good. How does it feel? Give me some words.
You are a miracle worker.
It's just chiropractic.
That's
It's not
insane. Oh my God. I haven't been able to like bend down in years and it not hurt.
Yeah, you had a pretty rough time bending down and touch your toes when we did the scoliosis check.
Yeah.
We could probably take another look at it. Let's do that one more time, actually.
On the left is the pre-adjustment still shot. You can see the high left shoulder, the skin folds on the right, and the curvature in the lumbosacral spine. And on the right is post-adjustment. You can see the shoulders have...
So, people usually don't come here and tell me how great they're feeling. So how can I help you today?
I model and I dance, so my back's like actually always hurting because when you're modeling you have to like hold weird poses, like your like body's turned all crazy and whatnot.
4, L5. Back into here. Pain?
Yes.
Pain? Let's try the right side on a pain?
Not really.
Pain?
A little bit.
So this one's dipping, this one's normal, and this one's just lagging just a little bit behind. And when I do this, I can feel how your sacrum is tilted just a little bit that way, responding to this curvature here. Okay. March in place. Okay, do you feel yourself moving forward? You're getting closer to the window.
Oops.
That's okay. Walk towards me. All right, looking at the feet first. Left external rotation. Walk back towards that way. Does it on both sides. It's worse on the left. That's some ballet training right there, isn't it? Okay. All right, go back the other way again. We're gonna do a couple more. Okay, nice. Soft breath in through your nose, not through your mouth. How's our pressure, okay? Okay, another breath in and out. And again, deep breath in and out. Shoulders relax, good. Okay, let the shoulders relax.
Sorry.
It's okay. Yeah, unpoint your toes. Okay, now breathe. Breathe gently. Okay, let's see. Okay, let's adjust this AS here. Nice gentle breath in and out. Okay. So we're gonna do a push. Pisces form. Good. Nice soft breath in and out. Good. Let your shoulders relax. Let your hips relax and come down this way. Turn your head to the right. All the way.
Okay, back to center. Now to the left. Center. Here's what we're gonna do, nice and gentle, honey. So I'm gonna bring you over to the side like this, and then we're gonna kind of push in that direction, okay?
Okay.
Okay, it's gonna be super gentle.
Sorry. I don't know why I laughed.
Okay, so I'm gonna lift up your head like this. Let your head relax.
I'm sorry.
Right, here's what you're gonna do. You're gonna find this feeling right here. Drop. That's what you wanna do. You wanna drop. Drop your head, drop your shoulders, drop your hips. If I move you over to the right, drop. If I move you to the left, drop.
Okay.
You're doing great. I know you like to control things.
Yeah.
So, good. Let your shoulders drop. Good.
Yay. that's good.
Get in. Good. That was great. In. Good. Loosey-goosey here. Let your shoulders relax. Good. Toes are so tiny. I can't grip them. Too small. Let your shoulders relax. Good. Relax. More. Good. Squeeze. Relax. Relax your shoulders. Squeeze. Good. Relax. Relax. Look straight ahead. Good. Good. Go. Let this relax. Let it go. Let it go. You're doing good. Okay, lean forward just a little bit. I'm going to reach around the front here. Just let this go. Loosey-goosey. Let this go. Good. Good. Same thing. I'm going to reach around here. Okay, let your shoulders relax. Good. Let this go. Loose. Let your shoulders go. How's your back feel? How's your mid-back feel right now? You're okay? Okay. Okay, good. Good. Shoulders relax. Just kind of sink in. How's that pressure? Okay?
Whew.
You're doing good. Same breath. Let that out. Sink. Okay, keep your legs straight. Don't bend your knee. Keep your legs straight. Just lift the whole thing up in the air. Perfect. Down. Okay, now left. Down. Right. Down. Left. Down. Is it harder on one side than the other?
A little bit, yeah.
Which
On
side?
the left.
Harder on the left. Let your shoulders kind of come up like this. I'm going to bring your hips down in this position like that, and then we push in that direction, okay? Okay, gentle breathing. Good, and out. Good, we're going to bring your shoulder up like this. Good, there's more, hold on. Good, and out. Lay on your back. Okay, we're gonna bend the top leg like this. Here, just a little bit. Okay, letting your shoulders relax. Relax. Yep, good. We're gonna do the same thing. We're gonna bring the hip down and then push it in that direction, okay? It's already cracking because we know we're pushing it in the right direction. Bend out. Oh, lay on your back. Okay, let your hips relax. This is how we check the neck. Good. As you breathe out, feel your whole body sinking into the table. Let your head drop, let your shoulders drop. Good. I'm going to bring your head to right about here. We're going to push in that direction like that. Good. Let the shoulders sink. Good. Hips. How's that?
Good.
Yeah. 7, 6, 5, 4, 3, 1. Is this tender here?
Super tender.
Super tender. Okay, let this relax here. Let your head relax and sink in. Let your shoulders relax. Loose, loose. Let it go. Let it drop. There's more here. You're tense. Let it go.
I know.
It's just like the last one. It's gentle, gentle. Good breath. Good. Just nice and gentle here. You don't have to just breathe. One more time. Let this go. Let your ankle go. One more time. Let it go. Let it go. In your knees. Squeeze. Relax. Okay, I'm going to do an organ manipulation now, okay? Okay, so for this adjustment, we just use this towel to support your cervical spine, okay? Your hands are in a good place. Keep your teeth together. And I'm just going to use this to traction your spine in that direction, okay?
Okay.
Okay, let your shoulders and hips sink in. Okay, keep your teeth together, gentle breathing. We're going to traction your spine in this direction. Good. Come here and tell me how good they're feeling. So how can I help you today?
Well, my back has been hurting a lot lately, and my neck is very tight. So if you could do something to loosen that up, that would be great.
Okay, where does your back hurt?
In the lower back, and it's like every day. It's mainly when I wake up in the morning.
Okay, there's a couple segments here that I'm going to test the motion of, just to see how they're moving. Let your shoulders come back here. Yeah. Okay, come back up. Okay, that here. Now lean back into my finger here. Is that tender?
Yes.
Correct?
Yeah.
All right, so we're going to check out, is this tender here?
Mm-hmm.
Any pain there?
Yes. Oh my goodness.
Okay, come back a little bit more. There.
Mm-hmm.
Just lean back this way. Pain?
A little bit.
Left SI joint is clear. Now to the right. Pain?
Yes.
More tender on the left or right?
Right.
Okay. Tender.
Yes.
And these are all glute fiber attachments. And then the lumbar is showing up, and so we'll look at that from another angle, okay? So let's look at the glutes. Higher on the left, lower on the right. The left glute fiber is flat, and the right one is rounded. So this one is moved as an EX. But let's watch it move. So go ahead and walk in place, and lift your knees up higher. There you go. Good, just like that. Okay, I'm gonna let go and just observe. Go ahead, keep going, keep walking. Okay, good movement here on both sides.
My knee, probably.
Oh, it's your knee?
Yeah.
Okay. Okay, so pretty even. Your feet are dead even. Turn around and come back this way. You've got no swing in the feet, and both are coming up evenly off the ground. And the hip swing looks even from left to right. Go ahead and turn around and go back the other way one more time.
And you have just a little bit more hip swing on the left, a little where that right SI joint was tender. How does it feel when you walk? Do you feel even?
Yeah.
It's a perfect shirt for this actually, because I can actually visualize your lumbar spine here.
Good.
And I can tell that when you're laying down, you still have a little bit of tension. Let your shoulders relax a little bit. It's just a little bit elevated versus the right lumbar. We're gonna test the muscles here in your lumbar spine. Keeping your leg straight, I want you to lift this leg in the air.
This one?
Yep. Down. And now the left leg. Down. Well, you're very strong here. You definitely have very strong back. Did it feel the same on both sides? Was one side more difficult than the other?
It did feel the same on both sides.
Okay, good. All right, so let's just come in here a little bit deeper. Shoulders relaxed. Here.
Yeah, worse.
Worse. Okay, shoulders relaxed. Good. Just take some nice soft breaths in through your nose, Amanda. And out through your mouth. Lift your left hip up a little bit down. Okay, lift your right hip up a little bit and down. Tender. Just you yet.
Okay.
Let's just practice one. And we should hear some sounds, okay? You should feel some movement, but it's gonna be very gentle, okay?
Okay, good.
It's not gonna hurt at all. 1, 2, 3, 4, 5, 6, 7. Good, let your shoulders relax.
That feels amazing.
Okay, so this one's a little bit different. What we're gonna do here, Amanda, is as you breathe in, when you get to the top of your breath and breathe out, we're gonna give a little push at the top of your breath, okay? All right, so nice and gentle. Gently, and let your shoulders sink. Good. Breathe out. That's good. Okay, I'm gonna lift up your legs here, okay? Don't lift your legs, let me do the lifting. Top leg. I'm gonna scoot you forward.
Okay.
And then we're gonna pull this like this, and then this forward just a little bit too. Turn your head so you're facing straight that way. Good, breathe in through your nose. Good, shoulders let go. Oh, that's perfect.
Oh.
Perfect, lay on your back a little bit too. Okay, so same thing for this adjustment, okay?
Okay.
All right, nice and gentle breathing. We're gonna adjust the lumbar here on this side. Take a nice soft breath in and out. Good, let this relax here. Just kind of sink in. Good, just like that. Bang your back. Now through your mouth. Good, let your head drop.
Oh my god. Whoa. Wow.
Is there any pain? Did that hurt?
No.
Okay.
Felt great. It sounds like it would hurt, but it doesn't.
I'm gonna do a valve release, okay?
Okay.
So this is in your stomach. What I'm gonna do is locate the ileocecal valve. I'm gonna contact the belly button here and then the ASIS here. We're gonna find the spot in between the middle of those 2 points. Tender? Okay, breathe through your nose. So it does feel like you have a little bit of stagnation here.
Yeah, there's a lot of pressure right there.
That's good. Do that again. Raise your belly up with the breath. And out. How do you feel?
Great. Loose. My back feels really good.
Okay, squeeze. Good. Squeeze. Let this relax. Let it go. Let this go. Here, Amanda, we're gonna lean forward. Lean forward a little bit. Good. Let the shoulder relax. Okay, loose, loose. Let that down. Did you feel that?
Yes. Did a good job everywhere.
Okay.
Everywhere feels really good, especially right here.
People usually don't come here and tell me how good they're feeling, so how can I help you today?
Well, for when I have scoliosis, I crack everything
Mm-hmm.
constantly. But sometimes I'll get like really bad headaches
Okay.
if I like crack it in a weird way.
All right. How long have you been having these headaches for?
Yeah, probably only like a couple years.
All right. So what do you do to make the headache better?
Just ride it out.
You ride it out?
Yeah.
I mean, do you have to go lay down somewhere, or do you just deal with it?
Yeah, like in the dark.
So have you ever noticed any differences with your headaches when you're on your period? Before or after?
I don't have a period.
Okay.
No.
Why don't you have a period?
Because I'm on birth control.
Okay.
Yeah. So I don't know, like, timing-wise. Yeah.
So is there any other factors of the headache? Do you ever have any numbness or tingling in your face, in your ears?
I don't think so.
Mm-hmm. No other traumas, no other hospitalizations? No
that
other,
I know of.
no other kind of pain, shoulder, elbow, wrist, knee? No. Have you ever been adjusted before?
Been what?
Have you ever been adjusted before?
I can't wait.
You're excited, good.
I'm so excited.
Are you nervous at all?
No. I just want to, like, give it to me rough. Like, let's do it.
Right or left?
A little bit more on the right.
Okay, let's check the motion here. Lean back into my fingers. Good, come back. Pain there?
No, not that bad.
Okay, I'm gonna test the SI joint. Okay. Just kind of come back like this. Pain there on my thumb?
Can you do it again? It's not bad. It's...
You would feel it. It would
Yeah.
It would be obvious. Okay, open, close. Just the right leg. Just the right leg. Good, close. All right, so we've got movement on the left, but not as much movement on the right here. It feels like it's actually more rotated than it is curved. Mm-hmm. Did they take x-rays of it when you were a kid?
No, it was just kind of like a quick thing. Nothing was really done about it or said about it. Am I doing it right?
Yeah, it's perfect. Okay, there's more rotation on the right side here. The right ilium is moving, but the left side remains flat. Okay, stop. You're gonna feel my fingers on the back of your legs.
Okay.
I'm gonna trace this up to your glutes. So the right side is lower, saying it's potentially gone posterior and inferior. The left side is higher, meaning it rotated anterior or superior. Looking from the top view, the right side is more rounded, which means it's gone EX. So PI, EX, ASIN, potentially. All right, let's do Adam's sign. And then, if this can be visualized, I'm not sure, but the left side is just a little bit higher than the right side. Okay, go ahead and stand up.
So exciting. And now what's going to suck is, like, whenever I crack myself, it's going to, like, you're going to ruin me from me doing it myself.
Good. All right, let's do this now. I'm going to test your lumbar spine. So what I'm going to need you to do, keeping your knees straight.
Lift this leg in the air.
Good, down. Left. Down. Which side is easier?
I think left.
Tender?
Very.
More than this side?
On the right side is a lot worse.
Good. Let it all sink in. Let it all go.
Yeah, it was great.
Okay. And out. All right, so let your shoulders relax. Good. And breathe in through your nose, out through your mouth. Good. Let this come down. Good. Side like this. Good. Just like that. Let this all go. Hold the slouch. Good. Just like that. Good. Keep breathing.
Ooh.
I do, Julia, is bring it down like this, and then push in that direction, okay?
Okay.
Okay, same thing. Deep breath in and out. Good.
Oh, my heavens. Hoo-hoo-hoo. That was something.
On your back. Now turn your head to the left. Bring your right ear down to your right shoulder. Bring your left ear to your left shoulder. Tuck your chin to your chest. So we're dropping, just letting it go. Let me do all the work. Good. Okay, take a deep breath in through your nose. Now through your mouth. Okay, so let's test the left side here. Just let your shoulders and head just sink in.
All of that hurts.
Yeah,
by the
every
way.
single one of them almost.
Yeah.
We're gonna have to find the most important one. All right, let the head relax here. That's good. Okay, nice soft breath in through your nose and out. Gosh.
I think I'm paralyzed.
Move your toes.
No. It's not nearly as intense as when I do it myself. Or, I mean, like, that was more intense.
And I'm gonna lift your head like this, good. And then I'm gonna stretch it in this direction, lift again, and then pull it like that, okay?
I already felt some give there. I felt that.
Gonna open your jaw. All the way. Close. Open slowly. Close. All right, push your jaw to the right. All right, close your eyes. Ooh.
That was life-changing. Wow.
Okay, open. Close. Push to the left. Push your jaw to the left. Now, how's that feel?
Much better.
All right, go ahead. You got any more cracks in there? Let's see. Go ahead. How do you do it?
I know this is weird, but I'll do this too.
That's awesome.
Ooh.
Just kind of let this relax. Good. Okay, hold your knees together. Hold them together.
Oh, okay.
Okay, hold them together. Hard. Hold them hard.
That was like up through here.
Okay. Tender.
Mm-hmm.
Okay, breathe in through your nose. Good, and out. Breathe into your belly. Fill your belly up with air as you breathe in. Good. Out. This is what you need to be cracking on yourself, your ileocecal valve. Same thing, find your belly button and your hip bone, right?
Okay.
Connect the line right into the middle, and then usually go straight down from there. Yours is a little bit more inferior or further down.
Okay.
Not so bad, right? Does that feel better?
Yeah, it does.
What's the snake mean?
It represents loss of innocence.
Okay, let this relax. See if we can do it to that one. Damn, dude.
Are you impressed?
I am, dude. That's deep.
They say that it has to do with writer's block or something like that. But like some people say like if you're having like writer's block or like, and I don't know, so like stuck or it's good to crack it. I don't know. Sorry.
Did you just get tingles?
Yeah.
Okay, look straight ahead. Let me see your tongue. Clean it off and then let me see it again.
Clean it off?
Yeah, like just like you take all the saliva off of it. Okay. There's some candida going on your tongue. And it would help significantly in all aspects of your life if you did a sugar cleanse. 14 days, no sugar. You can do it. 2 weeks.
I love sugar.
Yeah, and so when you eat the sugar.
Is that why sometimes I have bad breath, you think?
Yeah.
Yeah. That's why I chew gum all the time.
It's not coming from your mouth. Sure are you? What kind of yoga did you learn?
Started power vinyasa.
Oh my god, of course you did.
Yeah.
You're a fire sign, or you're a Leo or an Aries?
Aries.
Yeah.
Yeah.
Okay, so you're naturally brown hair.
Mhm.
Blue eyes is natural.
Mhm.
Okay. You're most likely pitta. I'll take your pulse later and we'll do an Ayurvedic dosha reading.
Okay.
Yeah. Okay.
I've had like a herniated disc before.
Okay.
This was like right before I became an instructor,
Uh-huh.
and yoga worked it out. But I saw a chiropractor then, and he did like a whole X-ray. After looking at the X-ray, he's like, "You're like 10 millimeters, like your spine is like slightly over or something."
That we'll do an examination on your spine and then I'll get you adjusted. Okay.
Okay.
All right. Do you have any other comments, questions, concerns before we start?
No.
At the feet, we've got a bunion on the right, more pronounced than a bunion on the left. Moderate to severe on the right, minimal on the left. Go ahead and turn around. Let's see your Achilles tendon. Stand up even on both feet. Achilles tendon bowing on the right side, indicating pronation moderately, and then slightly on the left. On the left side, there is a varus stress on the left tibia. And then looking at the hips, we're restricted in movement to the left, more swing to the right. Go ahead and turn around the other way. Good. And then a little stiffer on the left side of the body. You can see left arm swing on the left in that initial walk. Let's see if it can continue. Left shoulder, left hip stiffness, not as much movement. All the restrictions on the left side of the body. Looking at the thorax, we have a translation on the x-axis to the left and a head shifting to the left. And then here, stop right there and turn around. Okay, I'm going to do a temperature assessment with the back of my fingers. So you're very symmetrical from top to bottom.
Okay.
Do you have pain up here ever?
Yes.
Okay, I'm going to push a little bit deeper into the muscles.
Mhm.
Is that thing tight right there? Is this tender?
And sometimes when I bend over, if I'm bending over for a while, getting back up, my like right in my low back, even farther down, that gets stuck.
Okay, any tenderness here?
A little bit.
Here?
A little bit.
There's actually a slight discoloration here. This is S2, so this is the almost at the top of the sacrum. Okay, now close. Open. Can't really do them at the same time, can you?
No.
Open. And close. Okay, I'm going to measure your glute fibers now, okay?
Okay.
You're going to feel my fingertips on the back of your hamstrings. You can let your arms relax. Good. You're going to feel my fingertips here on the back of your hamstrings. I'm sliding up to the bottom of the glute fold. We're lower on the right, meaning the right hip is rotated posterior, inferior. Okay, go ahead and march in place again. Okay, and stop. And just stand up nice and tall. Okay, observing postural sway here. Okay, it's pretty stable, which is indicative of a category 3, which is when you have a disc issue. So let's do it one more time. March in place. So I did see a little bit of lateral sway. Okay, now stop. So the left is short. The standing test was incorrect, which doesn't always happen. Okay, I'm going to bend your knees. Try not to help me, okay? Let me do the work. Left short stays short. Follow your breath. Gentle. Good. Same breath. Gentle.
Oh my god.
Good. Sinking in. Sinking, sinking, sinking. Good, so this one's a little bit different. This time we push at the top of the in-breath. So you'll breathe all the way in at the top, and then as you let go, we'll push. Let your shoulders drop as you breathe out. Okay, just breathe through it. We're not going to be here long. I'm going to stretch your shoulders up in this direction like that, and then I'm going to bring your hip down like this. We're going to push like that, okay? A little up here like this. Go a little bit further down. Almost there.
Oh my god.
Okay.
That was cool.
Yeah.
That felt good. Like relieving.
Okay, breathing out. Shoulders relaxed. Good. A little bit more.
Oh.
Good. And right from there, let's sit up.
Okay.
Good. Back to center. Now to the left. Back to center. Okay, more conflicting evidence. You're just a bottle of contradictions today. Nothing was working on you. Okay, go ahead and bring your right ear down to your shoulder.
My right ear down to my
Good, good. Gentle breathing, sinking in. Good. Good.
Oh, holy.
6, 5. Testing. Let this relax. 7, 6, 5, 4, 3, 2. 2. Okay, nice and gentle breathing, sinking. Good. Good, letting it all go.
Oh my God.
Are you ready?
A big deal. Oh my God.
Any pain there?
Yeah, a little.
Okay, nice gentle pull here. Just let this relax. Painful?
A little.
You can do
Yeah,
it.
in there.
That was it. Did you feel it?
Yeah.
It's moved. It's a little bit more.
Oh.
Cool.
Oh.
Okay, I'm gonna hold on to the back of your knee like this. Just let this bend a little bit. Okay, is there any pain, discomfort in your hip when we do that? Okay, I'm gonna give this a pull. Good. Pain?
No.
One more. Good. 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 Keep your teeth together. Your hands are good right there, and I'm gonna follow your breath like this. At the end of your breath, we'll pull in that direction, okay? Breathe.
Oh my God. Oh my God.
Good job.
Wow. Perspective, if it's bone on bone like that, like I'm gonna need to get hip surgery.
As of right now, the answer is no. Like, you're functional and you're moving. Okay, squeeze. Good. Squeeze. Okay, good. Strong on the left hand there.
Yeah,
You're not left-handed though, are you?
I am.
That's why your spine was... Oh, man. You have a lefty spine. I
I
knew it the
did.
whole time, but didn't... Yeah. Here we go. Let's get your fingers.
My fingers don't crack. Oh.
There's no pain there? You're hypermobile. Good.
Oh, I didn't know you could do that. Oh my God.
Go let this shoulders relax. Let's try that lunge.
Okay.
Well, that one actually looked a lot better too
Yeah.
than the first time.
About like the middle to upper back.
Okay.
I hold a lot of tension there.
Have you always had this pain? Has it been there for a long time? 1 year, 5 years?
It's been there since college.
Yeah. So we've got mid-back pain, about 5 years old. It gets agitated with stress. Just physical stress, moving around kind of stress, or...
Mental, emotional stress.
Okay. All right, so we'll start off with an exam, and we'll see what your spine says, and then I'll get you adjusted. We'll go through it nice and slow. I'll explain everything that I'm doing while I'm doing it. Just to get a little bit warmer, right side, and then at the very top on the left. There's that rhomboid that everyone's talking about.
Super tense.
Now keep your feet together. Now move your knees apart from each other. Good. Back together. Good. Dropping on the right, but not on the left here. So there is some restriction on the left and some tenderness on the right SI joint. So we should look at your gait. Okay, looking at the back musculature here, we've got pretty even contraction, but there are definitely asymmetries here. So go ahead and stop. All right, and I'm going to slide up to the bottom of the gluteal fold here. They look pretty even, maybe slightly lower on the right, but pretty even from the top. All right, looking at the feet first. You're definitely walking the line. Not a model walk. Is that how you walk all the time?
I don't know.
Whoa, cool. All right, go back the other way. All right, looking at the knees to the hips, no varus. Hip swing looks, let's see, hip swing. Turn around and go the other way again. Swing looks even on both sides, perfect. Left shoulder slightly higher. No head tilt. Okay, perfect. Nice gentle breathing.
in and out. Good, gentle, gentle, gentle. We're gonna go one segment down. Let's do that again. Deep breath in, and then just really let your back relax as you breathe out. Good. Put this one up here. Very good. Sink, 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 sink. Down. Let's do that again. Deep breath in, and then just really let your back relax as you breathe out. Good. Okay, so moving all the way to the top of the thoracic spine. Same thing, just following your breath all the way out. Very good. Sink, 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 sink. Breath in. And then as you breathe out, let your shoulders relax. Does this feel the same, left or right? Which one's more?
Feels like there's more on the left side.
We're gonna cross your arms like this. All right, I'm gonna shoulders like this, hips like this, and then from here we're gonna push like that, okay?
Okay.
And out. Good, sinking, sinking, good. Lean your back. All right, so this is how we check the neck. Good. Okay, so the first thing that you're gonna do here, Alice, is turn your head to the right. Okay, back to center. Now to the left. Back to center. Shoulders, hips.
Same way as before, and breathe in, breathe out.
Correct. Good, into your nose. And out. Good, let it relax, sink.
Oh my god. Crazy.
This time.
Like, same as adjusting before? Okay.
In through your nose, out through your mouth. You can close your eyes. Good. Sinking in.
It was good. It was just really solid. It's cool.
Thanks. Dorsiflexion is even. Achilles tendon tension is also even. Okay, almost. That got a little bit tense in your hip there. Your hip tensed up. Let's try one more time. Let this go. Let the hips go, shoulders.
No.
Yeah. Hold them together. Don't let me pull them apart. Hold.
Oh. That's a very uncomfortable, weird one.
That is an uncomfortable, weird one. 2 points, and in the middle is the window in between the large and small intestine. Is that tender?
A little.
This is the pyloric sphincter. It's 2 inches above the belly button here. Nice deep belly breath. Breathe into your belly here. Belly breath in.
My teeth together though, so am I just gonna breathe through my teeth, or you want me to just breathe back
through
up
your
my
nose? Yeah.
Okay.
You're very proficient with your direction following. I have to say, you're very like, I need to make sure that I'm breathing correctly.
Yeah.
Which I admire a lot. The breath is important.
Oh.
What happened there? You were breathing out, and all of a
I
sudden
do?
you started breathing
I
in
had
again.
to breathe.
It's weird. Your breath, you stopped halfway.
It's okay, it cracked.
And then your body tensed up. What cracked?
Everything. It felt like my whole soul come through my body.
Look straight ahead. This is a pulse reading from ancient Chinese.
If you made it to the end of the video, guys and girls, thanks for watching and don't forget to subscribe for more.